Hello everyone. Today, we are going to talk about hypertension. Hypertension is the persistent elevation of blood pressure in the systemic arterial circulation. It is known to be the most common chronic health condition, and it affects 1/3 of adults, and this number continues to rise in all populations. It is a disease of aging. This means that hypertension is most commonly seen when people are getting older and older. It is rare in children and adolescents, and a diagnosis in those under 30 years needs careful evaluation. Also, it shows a continuous relationship between the cardiovascular system and the renal system. As we have said earlier, hypertension is a persistent elevation of blood pressure. Blood pressure is the collective force of circulating blood on the walls of the arteries. It is taken using two measurements: systolic blood pressure and diastolic blood pressure. Systolic blood pressure measures the force your heart exerts on the walls of your arteries each time it beats. Diastolic blood pressure measures the force your heart exerts on the walls of your arteries in between beats. Blood pressure is recorded with the systolic blood pressure on the top and the diastolic blood pressure below, and it is measured in units of millimeters of mercury. Let's talk about the clinical features of hypertension. Most of the patients with hypertension are asymptomatic during the initial stages, but during the late stages they might show recurrent headaches, epistaxis or nosebleeds, visual disturbances, or dizziness. These features present as complications of hypertension-related organ damage. So now, let's talk a bit about how to measure blood pressure in the clinical setting. When blood pressure is measured, the readings are usually taken from the non-dominant arm. The patient should be in a seated position. There should be at least 5 minutes of uninterrupted rest before starting the blood pressure measurement. The back of the patient should be well supported and the legs should not be crossed. When assessing the size of the cuff to be used on a patient, usually it should cover 80% of the arm circumference. The cuff should be placed at the level of the heart and the arm should be well supported. Also, at least 2 readings should be taken at each setting to get the best results. Hypertension can be divided into 2 types. They are primary hypertension and secondary hypertension. Primary hypertension is also known as essential hypertension. Patients who do not have an identifiable cause for hypertension come under primary hypertension. This is the most common type of hypertension, and about 90% of the population with hypertension come under primary hypertension. So, what are the risk factors for hypertension? Lack of exercise, excessive alcohol use, heavy smoking, drugs such as nonsteroidal anti-inflammatory drugs, oral contraceptive pills, corticosteroids, and antidepressants like venlafaxine are known risk factors for hypertension. In secondary hypertension, there will be a single identifiable cause. Out of the population with hypertension, around 10% of the population have secondary hypertension. People less than 30 years are likely to have secondary compared to primary hypertension. There are many causes of hypertension. Some of the most common causes are primary hyperaldosteronism, obstructive sleep apnea, obesity, coarctation of the aorta, renal artery stenosis, chronic kidney disease, hyper or hypothyroidism, and pregnancy. Now let's talk about the complications of hypertension. Long-term hypertension can lead to cardiovascular problems such as myocardial infarction, heart failure, and stroke. There can be loss of vision due to damage to the blood supply of the heart. Progressive kidney failure and sexual dysfunction are common complications of long-term hypertension. The management of hypertension can be divided into lifestyle modification and drug treatment. In lifestyle modification, we advise the patient to exercise regularly, eat a healthy diet, and reduce the amount of salt in the diet. The patient should limit the amount of alcohol intake and should quit smoking if a chronic smoker. Avoiding stress will reduce hypertension, as psychological stress is the main trigger for hypertension. As for the drug treatment, we can use ACE inhibitors like captopril, enalapril, and ramipril. Also, angiotensin II receptor blockers like losartan and candesartan can be used instead of ACE inhibitors. Calcium channel blockers like amlodipine, nifedipine, felodipine, and verapamil can be used along with ACE inhibitors. Also, thiazide diuretics like chlorothiazide and dapamide are used in treating hypertension.
Hope you enjoyed the video and don't forget to like, comment and subscribe.